Imagine a thief operating in plain sight, yet completely unseen. A silent saboteur, slowly but surely eroding the very foundations of your body. This isn't a plot from a sci-fi movie, it's the stark reality of osteoporosis, often dubbed the silent bone thief. For millions globally, their bones are gradually becoming porous, brittle, and susceptible to fracture, all without a single warning sign until it's too late. It's a condition that doesn't announce its arrival with pain or fever. Instead, it silently weakens the internal architecture of our skeletons, making even a minor fall potentially catastrophic. This video will pull back the curtain on this insidious disease, revealing how it operates and, more importantly, how we can fight back to protect our vital bone health. To truly understand osteoporosis, we must first grasp the incredible dynamism of our bones. Far from being inert structures, bones are living, active tissues constantly undergoing a process called remodeling. Throughout our lives, old bone tissue is broken down by cells called osteoclasts, and new bone tissue is built by osteoblasts. This intricate dance of destruction and creation is crucial for maintaining bone strength, repairing microdamage, and adapting to mechanical stresses. Think of it like a continuous renovation project for your internal scaffolding, ensuring its integrity and resilience over decades. This balance is key. When it's disrupted, problems begin to emerge. Bone mass accrues rapidly during childhood and adolescence, reaching its peak somewhere in our late 20s to early 30s. This peak bone mass is a critical determinant of our lifelong skeletal health. The denser our bones are at this peak, the more reserves we have to draw upon later in life. Imagine it as filling up a bank account. The more you deposit early on, the more you have to spend in your retirement years. After this peak, the balance often shifts. We begin to lose bone mass gradually, a natural part of aging. However, in osteoporosis, this loss accelerates dramatically, leading to dangerously fragile bones. The prevalence of osteoporosis is staggering. Worldwide, it affects an estimated 200 million women, and men are not immune either. 1 in 3 women and 1 in 5 men over the age of 50 will experience an osteoporotic fracture. These aren't just minor breaks, they can be life-altering events, leading to chronic pain, disability, and a significant loss of independence. Hip fractures, in particular, carry a high mortality rate and often necessitate long-term care. These statistics underscore the urgent need to understand and address this pervasive public health challenge that silently cripples millions. So, what goes wrong in osteoporosis? At its core, the delicate balance between bone formation and bone resorption is disrupted. Either the body fails to form enough new bone, or too much old bone is reabsorbed, or both. This imbalance leads to a net loss of bone tissue. The internal structure of the bone, which normally resembles a strong honeycomb, becomes sparse and fragile, with larger, weaker spaces. This structural compromise significantly reduces the bone's ability to withstand stress, making it highly susceptible to fractures from minimal trauma. It's like the support beams of a building slowly eroding, making the entire structure vulnerable. The insidious nature of osteoporosis lies in its lack of early warning signs. You don't feel your bones thinning. There's no pain, no swelling, no fever to alert you that something is amiss. This silent progression means that for many, the first indication of osteoporosis is a fracture, often from a fall that wouldn't normally cause a break in healthy bones. This could be a hip fracture, a wrist fracture, or most commonly, a vertebral compression fracture in the spine. By the time such an event occurs, the disease is already quite advanced, underscoring why proactive understanding and prevention are so vital. Several non-modifiable risk factors contribute to osteoporosis. Age is paramount. As we grow older, bone density naturally declines. Gender is another significant factor, with women being 4 times more likely to develop osteoporosis than men, primarily due to hormonal changes during menopause. Ethnicity also plays a role, with Caucasian and Asian individuals having a higher risk. A family history of osteoporosis or fractures also increases one's susceptibility, suggesting a genetic predisposition. While we cannot change these factors, being aware of them is the first step towards personalized risk assessment and early intervention strategies. Hormones play a critical role in bone health. Estrogen, in particular, is a key protector of bone density in women. During menopause, estrogen levels plummet, leading to an accelerated rate of bone loss. This is why women are at a significantly higher risk post-menopause. In men, a decline in testosterone, which can convert to estrogen, can also contribute to bone loss, although typically at a slower rate than in women. Other hormonal imbalances, such as overactive thyroid or parathyroid glands, or conditions like Cushing's syndrome, can also negatively impact bone metabolism. Understanding these hormonal connections is crucial for targeted therapies. Beyond genetics and hormones, numerous lifestyle factors significantly influence our bone density. A diet deficient in calcium and vitamin D is a major culprit. Sedentary lifestyles, lacking weight-bearing exercise, fail to stimulate bone growth and maintenance. Excessive alcohol consumption and smoking have been directly linked to lower bone density and increased fracture risk. Furthermore, certain medications, such as long-term corticosteroid use, can interfere with bone formation. These are the modifiable risk factors, areas where we have direct control and can make significant changes to protect our bones. Calcium is the primary mineral component of bone, providing its strength and structure. It's not just for bones, calcium is vital for nerve function, muscle contraction, and blood clotting. When calcium intake is insufficient, the body, in its wisdom, will draw calcium from the bones to maintain these critical physiological functions, gradually weakening the skeleton. Adult recommendations typically range from 1,000 to 1,200 mg per day, depending on age and gender. Dairy products, fortified plant milks, leafy greens, and certain fish are excellent dietary sources, forming the bedrock of a bone-healthy diet. Vitamin D is equally crucial, acting as the gatekeeper for calcium absorption in the gut. Without adequate vitamin D, even a calcium-rich diet won't fully benefit your bones, as the body simply can't absorb the mineral effectively. The primary source of vitamin D is sunlight exposure, which triggers its synthesis in the skin. However, dietary sources like fatty fish, fortified foods, and supplements are often necessary, especially in regions with limited sunlight or for individuals with darker skin tones. The synergy between calcium and vitamin D is undeniable, a powerful duo essential for robust bone health. Physical activity, particularly weight-bearing and resistance exercises, is a powerful stimulus for bone growth and maintenance. When muscles pull on bones, and when bones bear the body's weight, they respond by becoming denser and stronger. Activities like walking, jogging, dancing, hiking, and lifting weights are excellent for bone health. A sedentary lifestyle, conversely, leads to bone loss, as there's no mechanical stress to signal the bones to maintain their density. It's a classic use it or lose it scenario. Consistent movement is a non-negotiable component of a strong skeleton. Smoking is a notorious enemy of bone health. Nicotine and other toxins in cigarette smoke directly inhibit osteoblasts, the bone-building cells, and can even increase the activity of osteoclasts, leading to accelerated bone loss. Smoking also reduces blood supply to bones, interferes with calcium absorption, and alters hormone levels. Similarly, excessive alcohol consumption can impair bone formation, decrease calcium absorption, and increase the risk of falls, leading to fractures. These habits are not just detrimental to lungs and liver, they silently erode your skeletal strength, making quitting a vital step for bone protection. Certain medical conditions can significantly increase the risk of osteoporosis. These include autoimmune diseases like rheumatoid arthritis and lupus, gastrointestinal disorders such as Crohn's disease and celiac disease that impair nutrient absorption, chronic kidney disease, and even some cancers. Hormonal disorders like hyperthyroidism or hyperparathyroidism can also disrupt bone metabolism. These conditions often require specific management strategies that consider their impact on bone health, making a holistic approach to patient care absolutely essential. Medications are a double-edged sword. While some are life-saving, others can have detrimental effects on bone density. Long-term use of corticosteroids, often prescribed for inflammatory conditions, is a leading cause of drug-induced osteoporosis. Other culprits include certain anti-seizure medications, proton pump inhibitors, some antidepressants, and specific cancer treatments. It's crucial for patients to discuss their medication regimen with their doctor, as alternatives or bone protective strategies might be available to mitigate these risks. Never stop medication without professional medical advice, but always be informed about potential side effects. Diagnosing osteoporosis before a fracture occurs is paramount. The gold standard for diagnosis is a DEXA scan, or dual-energy X-ray absorptiometry. This non-invasive, low-radiation scan measures bone mineral density, BMD, at critical sites like the hip and spine. The results are reported as a T-score, comparing your BMD to that of a healthy young adult. A T-score of -1.0 to -2.5 indicates osteopenia, a precursor to osteoporosis, while a score of -2.5 or lower signifies osteoporosis. Regular screening, especially for at-risk individuals, can detect bone loss early, allowing for timely intervention. Beyond DEXA scans, other diagnostic tools and assessments are crucial. A thorough medical history, including family history, lifestyle factors, and medication use, provides invaluable context. Blood tests can check for underlying conditions that contribute to bone loss, such as vitamin D deficiency, calcium levels, and parathyroid hormone levels. Sometimes, bone turnover markers, which indicate the rate of bone formation and resorption, are also measured. Combining these assessments offers a comprehensive picture of an individual's bone health, guiding tailored treatment and prevention plans. Treatment for osteoporosis is multifaceted, aiming to slow bone loss, increase bone density, and prevent fractures. Lifestyle modifications are always the first line of defense, optimizing diet with sufficient calcium and vitamin D, engaging in regular weight-bearing exercise, and avoiding smoking and excessive alcohol. These changes not only support bone health but also improve overall well-being. Even if medication is necessary, these foundational lifestyle changes remain critical for maximizing treatment effectiveness and ensuring long-term bone protection. Pharmacological interventions for osteoporosis have advanced significantly. Bisphosphonates are the most commonly prescribed medications. They work by slowing down bone resorption. Other options include denosumab, a monoclonal antibody that also inhibits osteoclasts, and teriparatide, a parathyroid hormone analog that stimulates new bone formation. Romosozumab offers a dual effect, increasing bone formation while decreasing bone resorption. Estrogen therapy can also be considered for postmenopausal women, though it carries other risks. The choice of medication depends on the individual's specific circumstances, risk profile, and tolerance. Preventing falls is a critical component of managing osteoporosis, as fractures are often the direct consequence of a fall. This involves simple yet effective strategies such as ensuring adequate lighting in homes, removing tripping hazards like loose rugs, installing grab bars in bathrooms, and wearing appropriate, supportive footwear. Balance and strength training exercises, like Tai Chi or yoga, can also significantly improve stability and reduce fall risk. For individuals with advanced osteoporosis, assistive devices like canes or walkers might be recommended to enhance safety and confidence, preventing potentially devastating injuries. Living with osteoporosis requires ongoing management and vigilance. Regular follow-up with healthcare providers is essential to monitor bone density, assess treatment effectiveness, and adjust medications as needed. Adherence to prescribed treatments, even in the absence of symptoms, is crucial for sustained bone protection. Patients must also be proactive in reporting any new symptoms or concerns to their doctor. This continuous partnership between patient and physician is key to navigating the challenges of osteoporosis and maintaining the best possible quality of life despite the condition. Bone health isn't just a concern for the elderly, it begins in childhood. The foundation for strong bones is laid during our formative years, with adequate calcium, vitamin D, and plenty of physical activity. Ensuring children and adolescents consume a balanced diet rich in bone-building nutrients and engage in regular weight-bearing play and sports is paramount. Maximizing peak bone mass during these critical years provides a lifelong advantage, offering a larger bone bank to draw from as we age and significantly reducing the risk of osteoporosis later in life. It's an investment in future health. For women, the menopausal transition marks a pivotal period for bone health. The rapid decline in estrogen levels can lead to significant bone loss, often accelerating the progression of osteopenia to osteoporosis. Early conversations with healthcare providers about bone health during perimenopause and menopause are vital. Lifestyle interventions, and sometimes hormone replacement therapy or other bone-preserving medications, can be discussed to mitigate this accelerated bone loss. Being proactive during this phase can significantly impact long-term skeletal strength and reduce fracture risk. Men also face osteoporosis risk, though often overlooked. While their peak bone mass tends to be higher and bone loss occurs later and more slowly, men are still susceptible, especially with age, low testosterone, or certain medical conditions. Hip fractures in men, for instance, are associated with higher mortality rates than in women. Awareness among men and their doctors about male osteoporosis risk factors is crucial for timely diagnosis and management, dispelling the myth that it's solely a women's disease. Men need to be equally vigilant about their bone health. The psychological impact of osteoporosis and related fractures is often underestimated. Living with chronic pain, fear of falling, and loss of independence can lead to anxiety, depression, and social isolation. The inability to perform daily activities, pursue hobbies, or maintain social connections significantly diminishes quality of life. Addressing these emotional and psychological aspects is just as important as managing the physical symptoms, often requiring support groups, counseling, and a holistic approach to care that considers the patient's entire well-being. It's not just about bones, it's about life. Understanding bone density reports can be empowering. Beyond the T-score, the Z-score compares your bone density to that of people your own age and gender. This is particularly useful for premenopausal women, men under 50, and children, as it helps identify secondary causes of bone loss. A low Z-score might prompt further investigation into underlying medical conditions. Learning to interpret these numbers, with guidance from your doctor, allows you to actively participate in your bone health management and track your progress over time, fostering a sense of control. Emerging research is continually shedding new light on osteoporosis. Scientists are exploring novel drug targets, gene therapies, and even regenerative medicine approaches to stimulate bone regrowth. The role of the gut microbiome in bone health is another fascinating area of study, suggesting that the bacteria in our intestines might influence nutrient absorption and inflammatory processes that impact bones. These advancements offer hope for more effective treatments and even potential cures in the future, promising a brighter outlook for those battling the silent bone thief. The economic burden of osteoporosis is substantial. Fractures, especially hip fractures, incur enormous healthcare costs due to hospitalization, surgery, rehabilitation, and long-term care. These costs place a significant strain on healthcare systems and individual finances. The indirect costs, such as lost productivity and caregiver burden, further add to this societal impact. Investing in prevention and early diagnosis is not just about individual health, it's a critical public health strategy to alleviate this growing economic strain and ensure a healthier, more productive population. Nutrition extends beyond just calcium and vitamin D. Other micronutrients play supporting roles in bone health. Magnesium, for example, is essential for vitamin D activation and contributes to bone structure. Vitamin K is crucial for bone protein synthesis. Trace minerals like zinc, copper, and manganese also play vital roles in bone matrix formation. A diverse, balanced diet rich in fruits, vegetables, whole grains, and lean proteins ensures a comprehensive intake of these essential nutrients, creating a synergistic effect that promotes overall skeletal resilience and strength. For those with osteoporosis, safely modifying daily activities is key to preventing fractures. This might involve using reaching tools to avoid bending and twisting, sitting down for tasks that previously required standing, or asking for help with heavy lifting. Adapting the home environment, as discussed earlier, is also critical. Occupational therapists can provide invaluable guidance on these adaptations, helping individuals maintain independence while minimizing risk. It's about smart living, not limiting life, finding ways to continue enjoying activities safely and confidently. Postural exercises and awareness can significantly benefit individuals with osteoporosis, especially to prevent vertebral compression fractures. Strengthening back muscles, improving core stability, and maintaining proper spinal alignment can reduce strain on vertebrae and minimize the risk of developing a dowager's hump. Pilates, specialized yoga, and targeted physical therapy exercises are excellent for this purpose. These practices not only enhance physical strength but also improve body awareness and balance, contributing to overall stability and reducing fall risk. Good posture is more than aesthetics, it's bone protection. Building a strong support network is invaluable for anyone managing a chronic condition like osteoporosis. This could include family, friends, support groups, or online communities. Sharing experiences, challenges, and successes can provide emotional support, practical advice, and a sense of belonging. Knowing you're not alone in your journey can be incredibly empowering and help combat feelings of isolation. Healthcare providers can often point to local or national osteoporosis foundations that offer resources, education, and peer support, fostering a community of resilience. Advocacy plays a crucial role in raising awareness and driving change. Supporting organizations dedicated to osteoporosis research, education, and patient advocacy helps ensure continued progress in understanding and treating this disease. By speaking up, sharing personal stories, and advocating for policies that prioritize bone health, individuals can contribute to a broader movement. This collective effort can lead to better funding for research, improved screening guidelines, and greater public understanding, ultimately benefiting current and future generations. Your voice truly matters. Consider the long-term perspective. Preventing osteoporosis and managing it effectively is an investment in your future self. It's about maintaining independence, mobility, and quality of life as you age. Every step taken today, whether it's choosing calcium-rich foods, staying active, or getting a DEXA scan, contributes to the resilience of your skeleton decades down the line. Don't wait for a fracture to act, proactively nurture your bones now. They are the silent foundations supporting your entire life, and they deserve your continuous care and attention. Ultimately, knowledge is your most powerful weapon against the silent bone thief. Understanding the risks, recognizing the importance of early detection, and embracing proactive lifestyle choices can make a profound difference. Educate yourself, talk to your doctor, and empower those around you to prioritize bone health. Let's break the silence surrounding osteoporosis and ensure that fewer lives are shattered by preventable fractures. Your bones are worth protecting, and with the right information and actions, you can safeguard your skeletal future. We hope this deep dive into osteoporosis has provided you with valuable insights and empowered you to take control of your bone health. Remember, your skeleton is a marvel of engineering, constantly rebuilding and adapting. Give it the care it deserves. If you found this video informative, please give it a thumbs up, share it with your loved ones, and subscribe to our channel for more in-depth health discussions. We appreciate your support and look forward to bringing you more content that empowers you to live a healthier, fuller life. Your bones will thank you. Before we go, remember that this video is for informational purposes only and is not a substitute for professional medical advice. Always consult with a qualified healthcare provider for any health concerns or before making any decisions related to your health or treatment. The information presented here is based on current scientific understanding and general medical guidelines, but individual circumstances can vary greatly. Prioritize your health by seeking personalized care and guidance from your doctor. Stay informed, stay healthy, and protect your bones.